Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thanks for joining us. Today on Community Health Heroes, we'll be speaking with Mike Griffin, CEO of Daughters of Charity Services of New Orleans, who'll be talking about improving your health in 2017. And in recognition of Heart Month, Valerie Englade, Vice President Community Affairs at East Jefferson General Hospital and 2017 Go Red for Women co-chair, sharing heart health tips and talking about the upcoming Heart Month events. And joining us for today's Eat Fit NOLA cooking segment, we'll be in the kitchen with culinary legend Chef Andrea Apuzzo of Andrea's Restaurant and Emily Eickhoff of Eat Fit NOLA. So don't go away, we'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome to Community Health Heroes. 2017 has just begun and people are trying their best to stick with their various New Year's resolutions to diet, exercise, quit smoking. Some are specific in their goals, while others just want to improve their overall health in general. Join us today to talk about available health resources and what you can do to improve your health in 2017 is Mike Griffin, CEO of Daughters of Charity Services of New Orleans. Thank you for joining us today, Mike.
And thank you for having me. I'm so honored to be here with you today.
Oh, thank you. Daughters of Charity has really expanded. Can you tell me about the locations and the services you're offering?
Yes. Well, we've been expanding ever since Katrina. Before Katrina, we had one location. And now we're up to 10 actual health centers. We have 3 in Jefferson Parish and 7 in Orleans Parish. Our flagship location is still on Carrollton Avenue. But we provide services at all of our locations. We have full primary care services. We go from prenatal care for pregnant women to geriatric care. So we have pediatrics, adult and adolescent health care. We focus on primary care and prevention. So we are certified patient-centered medical home at all of our locations. And what that means is we do comprehensive primary care. We have behavioral health that's actually incorporated and integrated with our primary care services. So we have counselors that are in the clinics. We also have pharmacy services. We have dental services that are at our locations, optometry services. So we have a full array, a one-stop shop for primary care and prevention.
Can you coordinate the care? Like if somebody comes in and they have a primary care appointment, could they possibly get their eye appointment and their dental appointment on the same day or close to each other?
Yeah, they get them very close to each other. I won't commit to it always being the same day, but some days we do that. And I'm a patient of my own services and my family. I have 5 kids, so some days we bring the entire family for our healthcare services, be it our dental care or even our medical services.
Now, I understand that you're also in some of the schools.
Yes, we also have 3 schools that we're working with, and we provide physicals and medical services. We have dental care at those locations, and we do behavioral health, and we have counselors at those sites. We have 4 mobile medical units. 2 of them actually provide medical care, and 2 of them also provide dental care.
That's amazing. That's very comprehensive.
Yes, ma'am.
Do you know about how many patients you serve a year?
We're up to about 45,000.
Oh my goodness.
And growing. So
that's phenomenal.
And we take all insurances, Medicaid, Medicare, commercial plans, Blue Cross. We also have we have a sliding fee scale for those who don't have insurance.
Oh, that's wonderful. Now, there's a possibility the Affordable Care Act can be repealed. Can you tell me how that's going to impact your services and the members of our community?
Yes, I've heard a lot about that, and of course all of America has, and we're not so concerned with the repeal, but we're really focused on the replacement. We've experienced tremendous opportunities with the current plans, with Medicaid expansion, with the marketplace, but if patients are able to still have coverage, that will help them continue to have better access to things like primary care, but also specialty and diagnostic services that are needed and necessary.
That's awesome, Mike. So Louisiana moved up one tiny little point in America Health rankings. They went from 50 to 49. What can we do to help improve the health of our community?
I think we really need to continue to concentrate on primary care services and preventing unnecessary hospitalizations, the costly ER utilizations, and help patients to get educated on their own conditions, the chronic conditions that they may have, help them to get their medications. We have pharmacies in all of our locations. We're working very closely with the community, all of our patients, schools, other agencies to help to educate populations. We're focused a lot on pediatric care. We feel if you really work with the youth of our community, that will assist or help in the long term improving that 49 status and get us to the top 10 maybe. I'm very hopeful, but at least it will educate our community at a young age on how to take care of themselves when they're in the pit of life.
Well, do you provide any kind of education on like how a child should eat and how much exercise they should
Correct.
get?
So we actually, all of our providers are working with our patients on the BMI, body mass index, and how their size and growth that goes into their dietary habits, their environment. We have a lot of asthmatic kids, and we work with the parents on how to better the environment and the air that those kids breathe, both at home, in their schools. We have prenatal services. So we work with our OBGYNs and our pediatricians. They work together. After the baby's born, we work with parents and educate them on healthy, nutritious eating habits, both for the mom and the baby, so that the baby grows up strong and healthy.
That's a great opportunity there. Well, I have one last question, Mike. You are just a wonderful person on the show, lots of information you provided, but if we wanted to find out how to get more information about Daughters of Charity, where would we go for that?
Well, you would go to our website, www.dcsno.org, or you also just call 504-207-3060.
Mike, thank you for joining us on the show and sharing this very helpful information with our audience today.
Thank you for having me.
When we return, we'll be speaking with Valerie Englade, 2017 Go Red for Women co-chair, about her upcoming Heart Month events. So be sure to stick around for more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. While many people recognize February as Black History Month or for Valentine's Day, did you know that it is also American Heart Month? Joining us today is Valerie Englade, 2017 Go Red for Women co-chair. Thank you so much for joining us on the show today, Valerie.
No, thank you. Glad to be here.
Can you tell me a little bit about your roles?
Well, I am fortunate that I'm serving as co-chair for the Go Red for Women campaign this year with the American Heart Association. Also, I'm Vice President of Community Affairs at East Jefferson General Hospital. And again, we're supporting it because we know the value of education and prevention as it's related to heart disease.
That's incredible. So can you also tell me a little bit about your upcoming events, some fundraisers that are going on, because you guys are quite active throughout the whole year, not just in February.
We have a lot going on in February, obviously, because it is Heart Month. So we've got the Go Red for Women event on February 2nd and National Wear Red Day on February the 3rd. But this cause goes on throughout the year. So we've got the Heart Gala, the Heart and Soul Gala, which is in June, and then the Heart Walk, which is in November, which gives everybody the chance to participate.
So tell me about the Heart Walk in November. You don't have to be a member of any society. You don't have to be in any specific condition. Tell me about that.
That's open to everybody.
Okay.
If you can walk, you can roll, you can run. That's an event that, again, is, and it's such a large community event. This year it's going to be held at Champion Square again, which
Okay.
makes for a really fun event. You know, we all want to be down by the dome, but it's about the importance of monitoring your health, knowing the signs and symptoms, but then knowing what you can do to address it.
So unfortunately, Louisiana has now once again ranked 49. I mean, they moved up from 50th to 49 with America Health Rankings, and we have a lot of problems with diabetes, obesity, and heart disease. Can you tell me some tips that you would recommend to our community on what they can do to be healthier or prevent heart disease?
Well, and so much of those chronic conditions are tied together. So the things that we all can do to better manage our health, I think they're pretty simple, but again, it's having a primary care physician, someone that you see at least annually to help you monitor those concerns. You know, exercising daily. The Heart Association recommends 30 minutes of exercise every day.
So I understand that 30 minutes does not have to be all at once, because that's sometimes hard for people to fit in. So am I correct, or can you give me some information on that?
Exactly. I mean, it is, you know, taking the stairs instead of taking the elevator. You know, maybe taking the long way around somewhere. If you have, you know, biking for, you know, 15 minutes, doing some type of exercise, even if it's 10 or 15 minutes in the morning, and then, you know, working throughout the day. It's just to try and not be sedentary.
And a lot of us have jobs where we are sedentary, so even maybe some walking meetings or something.
Yeah, that's a great point. And how many of us actually get things done in what we call a hallway meeting? So actually getting out of your office and walking around is key. Not only for your body, but for your mind too, so you can stay active and in control.
And I think the American Heart Association, in partnership with United Healthcare, has several walking paths in the city, correct?
Yes, a number of those, and again, that's where it's so key. Take 15 minutes out of your day and hit those trails.
And they even have like little things on how far you've walked, right? Like if you walk this 6 times, you've walked a mile.
Yes,
Little
and you know,
markers.
even at East Jefferson, we've got some things marked out as far as, you know, walking paths throughout the building.
Oh, wow.
Because, you know, again, you're busy all day. How do you fit that in? And that little bit of exercise every day, as well as just eating healthy. You know, trying to really watch your diet, and it doesn't need to be cut everything out, but, you know, all things in moderation.
So why are we focused on women and heart disease? You know, men have heart disease, women have heart disease. What makes women different?
Women's symptoms are very different than men. So knowing what those differences are and how it feels to you really help in diagnosing and seeking treatment. But 1 in 3 women in the United States will have some form of cardiovascular disease. That is, more women will be affected than all cancers. So when we look at that, 80% of heart disease is preventable. So not only knowing what those signs and symptoms are, but what you can do. And it truly is the simple things of having a primary care physician that knows your history and can help you manage any issues that you may have. Exercise and diet. And if you smoke, you need to quit. That is really one thing that has just the negative health effects for not only heart disease, but so many other conditions are key. So.
And then I think having a primary care doctor also helps, that they can get preventative testing done. You know, they can run an EKG when you're at a certain age and things like that too.
Absolutely. We should all have a primary care physician that we see minimally on an annual basis. Get a full physical so that your physician then knows here's the base. So, you know, as we age, things start to happen. So you can really monitor those concerns and treat it.
Right, they monitor your weight, they can monitor your cholesterol, so it's really important to have a primary care doctor.
That is the key to a healthy life.
And then if our audience want to find more information about their heart health, some information about your events, where would they go for that?
All the information is on heart.org, and that's where you can find not only the signs and symptoms for women and heart disease, but all the information on all the great events that we do throughout the year.
Valerie, thank you so much for sharing this very important information with us today.
Thank you so much. I really enjoyed it.
When we return, we'll be in the kitchen for our Eat Fit NOLA cooking segment with Chef Andrea Apuzzo of Andrea's Restaurant. So be sure to stick around for more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better for you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just
Please, don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Welcome back. Joining us in the kitchen today is Chef Andrea Apuzzo of Andrea's Restaurant and Emily Eickhoff of Eat Fit NOLA. Welcome to the show.
Glad to be here with you.
Yes,
what a pleasure,
thanks for
honor.
having us.
My pleasure. So what are you making for us today?
I was born and raised in Italy in a very small town called Caprese. So I like to cook light. I like to eat healthy. As you know, I have fresh oregano here. I have the fresh herbs. I have fresh basil. All fresh ingredients. I also eat a lot of greens. So I like to cook light. I like to cook with extra virgin olive oil. And I like simplicity. Mm-hmm. Food doesn't have to be complicated to be good. So you cook it nice and healthy, flavorful. Use fresh as much as you can. And that's what they give the flavor. You don't have to use animal fat like butter or lots of cream and so on. So simplicity is always the best. And I'm going to show you a dish here that we're cooking for many years, and it's one of my recipes. I love it. Another thing I like to cook on gas. It's really one of my favorite things to do. It's always you can control a little bit better on the gas, and I like to use the shrimps. These are the peeled, deveined Louisiana shrimps. Everything we make has got to be fresh, Louisiana first. I like to use a good ingredients, always fresh. White onions, We're going to cook this for 2 people. 1 tablespoon, if you can, white onion chopped up. And also I like good garlic, fresh garlic. As you know, garlic is very healthy for you. Put a little touch of extra there. And this is a very simple dish. Now again, it doesn't take too long to do this dish. It's simplicity, elegance, but very flavorful.
So Emily, about how many calories is in this dish, the shrimp dish?
Yeah, well, per serving, it's about 160 calories, which is pretty low,
Very low.
If you're going to be eating an entree, but it also has 13 grams of protein, so that's going to help keep you fuller longer, some really great lean protein in there.
Once you turn the shrimps a little bit in the reddish color as you see it, you can really use a little touch of white wine, dry white wine. I prefer something not too sweet, okay? And then we're gonna add this a little, I love this wine by the way. Don't tell anybody that wine is good for you.
It is good for you.
A little touch of white wine. And we're gonna put a little touch of fresh pepper. This is a pepperoncino we call. It doesn't have to be too spicy, but it's got a little bit in there, so it's worth it. Fresh oregano, like I mentioned before, everything we make is gotta be fresh.
Wow.
And we're gonna put Italian parsley. We'll put some rosemary. We have some fresh oregano over here, fresh basil, all chopped up, so it's easy for the camera to use it.
And the herbs give it a lot of flavor
so
with no salt.
No salt. If you want to put a little touch of salt, it's always welcome to do a little touch of salt. And a touch of pasta water here. You can make a little more light sauce.
I like how you use the pasta water because
Absolutely.
a lot of vitamins, get boiled out, but they're still in the water.
Absolutely.
So if you save it to use it for later.
And also, I always, when I started cooking in the kitchen, I always put a pot of water on the stove, bring it to a boil, no salt, nothing in there because you can use a lot of different variation that you can do. Then we're going to do on this plate, we're going to put on this plate right here, squeeze of fresh lemon juice. When it comes to a boil, it's ready to serve. And you can serve this dish, as an appetizer. And you can serve, we can serve with the pasta. I have pasta right here. And that's a very simple also that you can really enjoy this already. The pasta.
So you make your own whole wheat pasta, wow.
All whole, fresh, made from scratch. The shrimps come to a boil. And it's ready to turn the shrimps off because it's cooked. You don't want to overcook your shrimps.
Right. They get all hard.
Pinch of salt, a little bit of salt if you like. Not too much. So I recommend very highly to cut down on salt. You don't need too much salt, okay? A little bit, that's always good.
Because you're getting all the flavors from those beautiful herbs. Oh my gosh.
Mamma mia,
yes.
mamma mia.
Oh, very flavorful.
I'm sure you won't take me on with you today because, you know.
Yeah, you know how to cook.
We take the pasta out of the water. And this is a very easy, I love to always recommend very highly. Hot. Put the pasta over
I like
here.
that, keeping that right in your hot water. So
Yeah,
you
it's
just
so
warm it up
wonderful.
and it's al dente. And
And we're gonna serve, ready to serve the shrimps. Like I said, it's really nice and simple, wonderful
so
water.
where do you get all these beautiful fresh seafood, fresh vegetable ingredients?
I have several purveyors, local purveyors that come to me, and they bring it, you know, of course, licensed, you know. Buon appetito.
Thank you. Thank you, Andrea. So how did you get involved in Eat Fit NOLA? I know you cook healthy and you love fresh.
I've been for many, many years in Louisiana, and people knows I'm very conscious about, you know, cooking and healthy cuisine. And I always enjoy cooking healthy, and I've been very close with the Auctioner Clinic, and I had to open up surgery about 6 years ago, but I was still a little kid. The reason why I'm still alive because maybe I eat right over there. I eat healthy food every day, no animal fat, and I grew up with all this, you know, I grew up on a farm with making my own cheese, and,
Oh my gosh.
and my mama taught me how to do that, so it's really bountiful that, you know, I enjoyed doing it. But I want to pass it on to other people. I have several cookbooks, I wrote it, one especially in healthy.
Oh, great.
So it's light cuisine, light cooking, and I want to pass it on to other people. So.
Oh, that's beautiful. Because if we don't teach our generations how to cook,
absolutely.
they're not going to continue to be healthy. So that's awesome.
All right.
And you could get your cookbooks at your restaurant?
Absolutely. And now I'm going to cook the next dish.
All right, we're ready.
Hi, this is I'm a chef at Andrea's restaurant, of course, and I'm here with two beautiful young ladies. Mamma mia, one left, one right. I don't know if I can take it. I'm sweating right here. It's a beautiful dish. I like to recommend. It's one of our guest favorite dishes at Andrea's restaurant. First of all, I always start with the fresh ingredients. It's a beautiful fresh American red snapper, and it's a very simplicity, very easy to do it. It won't take too long. Of course, the longest thing to take to debone the fish, but I've been used to. I get my fish whole and debone my own fresh American red snapper. And what I do right now, I put a little touch of salt, not too much salt. Again, it's very cut down on salt if you can, because we got what it does to give the flavor is all the fresh ingredients we have. Fresh Italian parsley that we chopped up very fine, and we have fresh oregano here, and we're going to put this on top also. And in Italy we call acqua pazza. Acqua pazza because you got a little touch of the red crushed pepper that makes it a little spicy, crazy, okay? It's a devil style. It's a very, very, now of course you can put more. I don't like to put too much because not everybody likes spicy food. So you want a little bit in there, and we crush them in there, okay? No flour. That's the best about this dish. No flour, no fat.
So did you have to adapt many of these dishes a lot, or just a little bit to be Eat Fit NOLA friendly?
No, nothing at all.
You were very health conscious already, you know, before we even worked with
absolutely.
you. Yeah.
Now, one of the things about this, you got to have a nice, good, hot skillet. And also, too, the people say, oh, it doesn't stick. No, it doesn't stick because you have a nice, wonderful hot, you got to cook this in hot skillet. It won't stick. No flour, okay? Look how beautiful. It's very pretty. Beautiful. And this is a simple dish again. We're going to take some fresh garlic. I'm going to use again this way.
Okay.
I'm going to use again. I'm going to put this over here. I'm going to chop some fresh garlic, slice very thin. This garlic makes the sauce so flavorful.
So our team member Andrew has been working very closely with Chef Andrea, and he has, you know, developed a menu for Eat Fit there. They have over 15 dishes, ranging from, you know, appetizers, entrees, even desserts. And so we're really excited about the launch of Eat Fit there. There's a ton of great options there.
And Chef Andrea, how are these items selling? Are people receptive to this healthy food?
Oh my God, yes. Well, this is already the menu. It's one of the, I guess really enjoy. It's one of the best dishes we have in the menu. People, it's once you taste this fish, it's wow, it's so good. Because it's got everything in there. We take some cherry tomato, garlic. You see, this dish is also very important. Anything I do, you want a hot skillet, and you want onions and garlic caramelization. Caramelization is, you see the garlic is nice and golden brown.
Nice and brown,
here.
beautiful.
You see what, that's what it gives the flavor to the sauce.
Wow.
Okay?
Yeah.
It smells so good. That's wonderful. Now we take some cherry tomato. You can cut them in half or just squeeze them in there. These are very ripe cherry tomato. And that's what we do in Andrea's restaurant. You can use Roma tomato if you like. If you can make fish stock from the red snapper bones, is very healthy for you. Make fish soup. But also I have over here, like I told you before, I have a pot of water on the stove. And we're going to make the fish stock right here in the pan. Beautiful. Look how pretty.
That's beautiful.
Look how nice it is. Pretty, pretty.
And colorful again.
Oh,
and very,
gorgeous.
very little salt at all.
Very good. Now, this dish in my recipe, I tell in our cookbook that we could put this in the stove, in the oven, for about 5 minutes. Just in a nice oven here.
Kind of reduce the sauce a little.
Preheat the oven 400 degrees, and we leave it there for 5 minutes. 5 minutes, we take them out, put them on the stove. All right. We take the fish out because fish is cooked.
Yes.
You say, Andrea, how the fish is cooked? How do you know? Once you touch the fish nice and firm, you won't burn it. What about it? You don't get, it's not that hot. What we could do, let's reduce the sauce. This fish already done. I'm gonna make a little sauce because I want this. Everybody at the studio taste. The gentleman looking at, they have the word in their mouth. They say, oh, you had some more.
Your mouths are
A
watering.
little touch of salt, not too much. Okay. We're gonna take a little touch more parsley here. Put them on top of it, Italian parsley. Italian parsley gives flavor to the sauce. Again, green, as much green you can eat every day. It's so healthy for you. It's very important that you can really enjoy yourself. This fish is absolutely beautiful done.
Wow.
Wow.
Look how pretty. And we take the sauce.
And this is a very healthy. How many grams of protein are in this dish?
Yeah, so it has over 30 grams of protein.
Ooh, wow.
It's gonna keep you
For a
full.
long
No
time.
empty calories, really. You're getting a ton of nutrients, vitamins.
And the sauce came out lovely too. And there's no cream in it, no
No
butter.
cream, no butter, nothing. Just extra virgin olive oil. It's got a slice of garlic and cherry tomato. It's got oregano. It's got some chopped fresh Italian parsley and a little touch of red crushed pepper. And it's really simplicity. It just takes a little, love, because cooking is love, passion. It's an art. You really put your love into it. But here we go. It's a beautiful American restaurant per crazy water. Mamma mia.
I have like 2 more questions. We have this beautiful dessert. Now, how do we have a healthy dessert?
Sugarless chocolate mousse.
And what did you put
And
into
again, it's very easy. It's some powder, chocolate powder. And we mix up with sugarless, everything, the whipping cream.
Greek yogurt too, right?
Yeah. And this is melted down the chocolate. Mix them up, a little touch of coffee in there, espresso. If you want to do espresso, you get a little flavor. And whip them up, and that's it.
How many calories is in this, Emily?
So all of our desserts are under 150 calories. And you said sugar-free, under very low sugar and full of protein because of the Greek yogurt. So.
Oh, awesome.
Yeah.
So you've been in our community for decades. Do you have any advice for our audience if they were thinking about getting into a restaurant?
Love what you do, enjoy what you do, and give the best to others that you really enjoy from your heart, to give the passion and love of cooking and be healthy.
Well, it was our pleasure to have you
Glad
on the
to be
show
here.
today. And
What a
this
pleasure being here.
smells incredible, and every dish looks so beautiful and
Thank
colorful.
you so much.
Thank you. And we'll be back with more Community Health Heroes.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on our health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provided today has helped you and your family live healthier and happier lives. I'm Dr. Penny Walker, and we'll see you next time on Community Health Heroes.